Hi folks, welcome to a new video. Today we're doing another SaaS ideas video, and this time it's all about healthcare. Healthcare is a sector that affects everyone, but let's be honest, it's still full of inefficiencies. Long waiting times, manual paperwork, lack of access to specialists in rural areas, the list goes on. That's where SaaS solutions can make a real difference. With the right tools, we can solve these problems and make healthcare more accessible, efficient, and affordable. Plus, platforms like Fuzen make it easy to build these solutions without coding, so you can focus on solving problems rather than writing complex code. So, if you are ready to make an impact and build something meaningful, let's jump in and explore some ideas. The first idea we will be looking at is an AI-powered symptom checker. This would be an app that helps users figure out what might be wrong with them based on the symptoms they enter. It's like a first step before they visit a doctor. This kind of tool is great because it can save people a lot of time. Instead of rushing to the doctor for every little issue, they can get some guidance on what might be going on. Plus, it helps with early detection, which is always a good thing when it comes to health. The benefits of building this app would be, number one, its convenience. People can quickly check their symptoms before deciding whether they need to see a doctor. Number two, its preventive care. By catching symptoms early, we can reduce the number of serious health issues that develop. Ideal customers for this app include general consumers, telehealth companies, and healthcare providers who focus on preventive care. But there are also some challenges you need to look at. Here, it would be making sure the symptom checker is accurate. You'd need to train the AI with a massive database of symptoms and conditions and make sure it's constantly updated. Another challenge could be keeping the experience simple and intuitive so anyone can use it easily. You can build something like this using a no-code platform like Fuzen to create the front end, but integrating the AI models would likely require some custom development. The next idea is a patient management software for clinics. This kind of platform helps clinics streamline everything from patient scheduling to billing and record management. It's all about making clinic operations smoother, improving efficiency, and enhancing patient satisfaction. So, what's in it for you? Well, first up, it helps with efficiency. No more juggling paper files or manually updating schedules. Everything's automated. This means less time spent on admin tasks and more time spent on patient care. Second, you get an improved experience for both the patients and the clinic. Patients get faster, more accurate service, and clinics can handle a higher volume of appointments without the headaches. The ideal customers for this kind of software would be small to medium-sized clinics or independent practitioners. Basically, anyone who needs a simple, easy-to-use system without having to deal with complicated IT setups. But like any software, there are some challenges too. First, the competition. The market is pretty crowded, so you'll need to make sure your solution stands out. And the second is system integration. You'll need to make sure your platform can integrate with existing systems, as well as the other tools the clinic might already be using. You can easily build this type of platform using no-code tools like Fuzen. Fuzen has amazing database integration and process automation features, so you can get started without worrying about coding or tech overload. Next up, let's look at remote patient monitoring for chronic disease management. This system would let healthcare providers track their patients' vitals remotely in real time. Think blood pressure, heart rate, and oxygen levels, all monitored from the comfort of the patient's home. It's perfect for people with chronic conditions or those who are recovering from surgery and need continuous monitoring. The benefits of this system are huge. First, it helps monitor patients remotely, reducing the need for frequent hospital visits. Second, it allows healthcare providers to act quickly, especially when things go wrong. By spotting issues early, providers can make interventions before the situation gets serious. The ideal customers for this would be hospitals, clinics, and healthcare providers that specialize in chronic care management, post-surgery recovery, or elderly care. Now, the challenges are a couple of things. First, ensuring accurate data from monitoring devices is a big deal. If the data is wrong, it can lead to incorrect treatment. Second, there's the privacy concern around patient data. You'll need strong encryption and compliance with regulations like HIPAA. But the good news is that no-code platforms like Fuzen can help you build the front end and integrate with device APIs. You can get started without worrying about complex coding. Next up is a mental health support and therapy app. This app would provide a space for people to get mental health support through virtual therapy sessions and self-help resources. It's especially useful for individuals who feel uncomfortable going to in-person sessions or those living in areas with limited mental health services. The benefits of this app are clear. It makes mental health care accessible, especially for people in remote locations or those who want a more private way to access support. Plus, the app can include self-help tools like meditation exercises, journaling prompts, and stress relief tips. Ideal customers for this app would be individuals looking for discreet mental health support or anyone seeking easier access to therapy. It's also perfect for therapists and mental health professionals who want to offer their services remotely. Like any other app, the main challenge here is ensuring privacy and confidentiality. Mental health is sensitive, so building trust with users is key. Another challenge is having the right tools to help users, like mood trackers or exercises that actually work. However, if you wish to create this app, tools like Fuzen can help build the UI for this kind of app. Finally, let's talk about an appointment scheduling and reminder system. This app would help healthcare providers manage appointments and send automatic reminders to patients, reducing the chances of no-shows and late cancellations. It's especially useful for outpatient services or any clinic with a lot of daily appointments. The main benefits are that it automates scheduling and makes life easier for both patients and healthcare providers. Patients don't need to worry about forgetting their appointments, and providers can manage their schedules more efficiently. The ideal customers for this are clinics, doctors' offices, and even small healthcare practices looking to streamline their scheduling process. Challenges here are making sure the system must sync with the provider's calendar to show accurate availability and whether the app supports multiple communication channels like SMS, email, or WhatsApp. You can easily build this system using no-code tools like Fuzen. It has the flexibility to connect to existing systems and automate appointment scheduling with reminders, all without writing code. So, thanks for sticking around till the end. I hope this video has sparked some ideas if you're thinking about building a healthcare SaaS app. Whether it's remote patient monitoring, mental health support, or appointment scheduling, there's a lot of potential in this space. We'd love to know which healthcare SaaS idea you're most excited about, or if you have any other ideas in mind, drop them in the comments. Also, if you have any questions or need some more insights, feel free to ask. If you enjoyed the video, please give it a thumbs up and don't forget to hit the subscribe button before you go. Thanks for watching, and have a great day.